Welcome to the Deep Dive. Today, we're going to be diving into something that might sound a little dry at first, asthma guidelines,
Yeah,
but trust me, this is important stuff,
it is.
especially for you, as both a resident physician and a parent.
Right.
We're talking about the 2024 update
Yes.
from the Global Initiative for Asthma,
Uh-huh.
or GINA,
Yeah.
which is like the gold standard for asthma care worldwide.
Absolutely.
We're going straight to the source for this one.
Yes, we are.
The full GINA report,
Oh, real deal.
no shortcuts,
Dope.
and our mission to break down the biggest changes in these guidelines,
Yeah.
the stuff you can actually use tomorrow, both on rounds and home with your family.
For sure.
Because, let's be honest,
Yeah.
who has time to wade through a dense medical report these days?
Not me.
We've got you covered.
Absolutely.
So before we get into the nitty-gritty,
Okay.
let's set the stage.
Yeah.
You're probably thinking asthma.
Yeah.
I see it every day.
Right.
What's new? But here's the thing.
Okay.
Even though the fundamental definition of asthma hasn't changed much,
Yeah.
we're still talking about that chronic inflammation in the airways.
Right.
Those pesky symptoms like wheezing and shortness of breath,
Uh-huh.
and that unpredictable nature of airflow.
Yep.
The way we think about asthma and manage it
Mm.
is evolving.
Absolutely it is.
That's where it's interesting,
Right,
right?
it does.
Because for years,
Yeah.
we've been all about classifying asthma by
Yeah.
severity.
Right.
Mild, moderate, severe.
Mm-hmm.
But these new guidelines are like,
Yeah.
hold up, there's more to the story.
Exactly. And, it makes sense.
Yeah.
Because when you think about it, severity is like looking in the rearview mirror.
Okay.
It tells you how tough someone's asthma has been to control in the past.
Right.
But it doesn't tell you the whole story about what's happening right another way
Yeah.
or what might happen in the future.
Yeah, so we're not ditching the severity labels entirely.
No, not at all.
But we're adding some crucial layers
Yes.
to the picture.
Right.
GINA is shifting our focus to two key areas.
Okay.
How well the asthma is controlled at this moment,
Right.
and the risk of future problems,
Mm-hmm.
like asthma attacks or exacerbations.
Mm-hmm.
So it's not just about how bad your asthma is,
Right.
but about how well you're managing it and what could trip you up down the road.
That's sure.
And this is where those aha moments start to kick in, right?
I do.
Because this shift to personalized care,
Yes.
recognizing that everyone's asthma journey is different,
Uh-huh.
that's a game changer.
It really is.
It really is.
One of the most exciting aspects of these guidelines is how they empower both doctors and patients to make decisions together
Yeah.
based on individual needs and circumstances.
Okay, let's break this down.
Okay.
GINA actually provides checklists in the report,
Mm-hmm.
literally boxes you can tick off
Yeah.
to assess both symptom control and risk factors.
Right.
So for symptom control, we're looking at how often you're having daytime or nighttime symptoms,
Uh-huh.
how much you're relying on your rescue inhaler,
Yeah.
whether your asthma is messing with your daily activities,
Mm-hmm.
the stuff that really impacts your life.
Absolutely.
And there are even validated questionnaires like the asthma control test
Right.
or the asthma control questionnaire
Mm-hmm.
that you can use to get a more objective measure of symptom control.
Exact.
Okay, so we have tools to gauge how well the asthma is being managed.
Yep.
What about those risk factors?
Okay.
What are the red flags we need to watch out for?
This is where it gets pretty comprehensive.
Okay.
We're talking about everything from your history of past asthma attacks
Mm-hmm.
to how well you're sticking to your medication plan.
Right.
And it goes beyond just medication.
Okay.
Things like whether you're using your inhaler correctly,
Yeah.
you have other health conditions,
Right.
whether you smoke,
Right.
even socioeconomic factors, they all come into play.
That's a lot to consider.
It is.
As a resident, I can already see how this new framework could change the way I approach my patients tomorrow.
Yeah,
I'd be asking about things I never thought to ask before.
I bet.
And for you as a parent,
Yeah.
wouldn't these guidelines make you think differently about your own child's asthma?
Absolutely.
What questions pop into your head?
Oh, so many things.
Yeah.
I think any parent would be interested in understanding their child's individual risk factors
Yeah.
and what they can do to minimize those risks.
Right?
It really puts you in the driver's seat,
Uh-huh.
working collaboratively with your doctor
Yeah.
to develop a tailored plan for your child.
Okay, so we've got a handle on how to assess asthma in this new way.
Right.
But the million-dollar question is,
Okay.
how do these guidelines change how we actually treat it?
Right.
And this is where the two-track system comes in.
Right. GINA now outlines two main approaches to treatment.
Okay.
or tracks, if you will.
I like it.
Track 1 is the preferred method for most people.
Okay.
It involves using a combination inhaler
Mm-hmm.
with both an ICS,
Yeah.
that's an inhaled corticosteroid,
Right.
which helps reduce inflammation,
Okay.
and formoterol,
Mm-hmm.
which is a long-acting bronchodilator that opens up the airways.
Got it.
And get this, you use the same inhaler for both daily maintenance and as-needed quick relief.
Wait a minute.
Yeah.
The same inhaler for both.
Yeah,
That's a bit different from what we've been doing.
it is a shift.
Okay.
It's called MART maintenance and reliever therapy.
Got it.
And the reason it's preferred, studies have shown it's incredibly effective at reducing those severe exacerbations,
Yep.
especially compared to just using a short-acting bronchodilator like albuterol
Yeah.
for quick relief, which is what many people with mild asthma have been doing.
Right. Oh.
So it's like hitting two birds with one stone,
Yeah, I like it.
controlling the underlying inflammation, providing quick relief when you need it,
Mm-hmm.
all with a single inhaler. Makes sense.
But for our listener at home who might be hearing ICS and formoterol for the first time,
Sure.
can we break this down a bit more?
Yes.
What does it actually mean to use the same inhaler for both daily control and quick relief?
Sure. Think of it like a 2-in-1 shampoo and conditioner for your airways.
Okay.
The ICS is like the shampoo,
Okay.
cleaning out the inflammation and keeping things calm.
Got it.
The formoterol is like the conditioner,
Oh.
smoothing everything out and making it easier to breathe.
I love that analogy.
It's a good one.
So with track 1, you're basically giving your airways a good cleaning condition every day to keep them healthy.
Yes.
And you have that extra boost of conditioner on hand if things get a little rough.
Exactly.
And that brings us to track 2, which is the alternative approach.
Okay.
It involves using separate inhalers for maintenance and quick relief.
Right.
For quick relief, you'd use either a SABA,
Mm-hmm.
a short-acting bronchodilator like albuterol,
Right.
or a combination ICS-SABA inhaler. Got it.
Yeah.
So track 1 is the streamlined 2-in-1 approach.
Right.
And track 2 is a bit more traditional,
Mm-hmm.
with separate inhalers for different purposes.
Yeah.
But why is track 1 preferred?
Okay.
What makes it so special?
It boils down to safety and effectiveness.
Okay.
Studies have shown that using ICS formoterol for both maintenance and relief significantly reduces the risk of those scary asthma attacks,
Mm-hmm.
those exacerbations we talked about,
Right.
especially compared to using a SABA alone.
Okay.
And that's a big deal because fewer exacerbations mean fewer trips to the ER,
For sure.
less disruption to your life,
Yeah.
and potentially fewer courses of oral steroids,
Mm-hmm.
which can have their own set of side effects.
Right.
So it's really...
I'm starting to see why this is such a game changer.
Yes.
But how do we know which track is right for a particular person?
Okay.
Do we just pick one and hope for the best?
Definitely not.
Okay.
Remember those individualized checklists we talked about?
Yeah.
This is where they come into play.
So we're putting those checklists to work.
Absolutely.
Okay.
We take into account the person's symptom control,
Mm.
their risk factors,
Right.
their age. Did you know MART with ICS formoterol is now recommended even for children as young as 6?
Oh, wow.
Their access to medication,
Mm-hmm.
the cost,
Okay.
and most importantly, their preferences.
Right.
It's all about working together to find the best fit.
That makes so much sense.
Yeah.
It really puts the focus on the individual.
It does.
It's not a one-size-fits-all approach,
Right.
which is refreshing.
It is.
It is. It really is.
And that's what makes these guidelines so exciting.
Yeah.
They're moving us away from rigid protocols
Mhm.
and towards a more nuanced, personalized approach to asthma care.
Now, I know you're a parent,
I am.
and I'm betting you're wondering how all this applies to those little ones under 6.
Oh, yeah.
Because, let's be honest,
Mm-hmm.
diagnosing and managing asthma in that age group
Yeah.
can be a whole different ballgame.
It-
They can't exactly tell you what's wrong, right?
Right.
But don't worry, we'll delve into the specifics of managing asthma in younger children in just a bit.
We will.
Excellent.
Looking forward to it.
Because I know our listeners are eager to hear about that.
I'm sure.
So stick with us, folks. We'll be right back after a quick break
Sounds good.
to discuss how these new guidelines are changing the game for our youngest asthma patients.
All right. Welcome back to the deep dive.
We're picking up where we left off,
Okay.
diving deeper into the specifics of those 2 treatment tracks GINA outlines.
Mm-hmm.
Track 1,
Yep.
the preferred approach with the ICS formoterol combination inhaler,
Right.
and track 2,
Yeah.
which utilizes separate relievers and controllers.
Okay.
And just to reiterate, The best track for any individual is determined through shared decision-making between the patient and their doctor,
Absolutely.
taking into account factors like symptom control, risk factors, age, access, and preferences.
All of that.
Right? It's
Yeah.
all about finding that sweet spot, that personalized approach.
It is.
But let's unpack the actual treatment step best within each track.
Okay.
How do those work?
Okay, so both track 1 and track 2 have 5 treatment steps,
Yeah.
ranging from step 1,
Yeah.
which is for folks with well-controlled asthma,
Right.
to step 5, which is reserved for the most severe cases.
So someone on step 1 might only need their reliever inhaler once in a blue moon,
Right?
while someone on step 5 could be on multiple medications,
Yeah.
potentially even biologics.
Exactly.
And the beauty of this stepped approach is that treatment can be adjusted up or down as needed.
It is.
Let's say someone's asthma is sailing along smoothly on step 2.
Okay.
We might consider stepping them down
Yeah.
to reduce the risk of side effects
Yeah.
and simplify their regimen.
Right.
But if they start having more symptoms or those dreaded exacerbations, we can step them up to regain control.
Exactly. It's like a ladder.
Yeah,
You can climb up or down depending on how your asthma is behaving.
I like it.
So let's walk through track 1 step by step.
Okay.
In steps 1 and 2,
Yeah.
which cover people with mild or infrequent symptoms.
Okay.
The star of the show is low-dose ICS formoterol.
Got it.
This is your maintenance and reliever in one.
Right.
At these steps, you'd only use this inhaler as needed.
Okay.
Like if symptoms pop up, or
Right.
before exercise or exposure to allergens,
Got it.
you wouldn't be taking any daily medication at these steps.
Hold on a second. This seems like a big shift from the traditional thinking
It is.
that everyone, even those with mild asthma, needs a daily controller medication.
It is a significant departure,
Yeah.
and it's backed by robust research.
Okay.
Studies have shown that using ICS formoterol as needed is just as effective as a daily low-dose ICS for controlling symptoms in this group.
Wow.
But it comes with a much lower risk of those severe exacerbations.
Interesting.
One study even found that switching to as-needed ICS formoterol
Okay.
reduced hospitalizations for asthma attacks by over 50%.
50%.
Yes.
Now, that's a number that really drives home the impact of this change. So it's safer and equally effective.
Yeah.
A win-win.
A win-win.
What about those higher steps, 3, 4, and 5?
That's where MART, the maintenance and reliever therapy, really shines.
Right.
At step 3, you start using that same low-dose ICS formoterol inhaler twice a day as your regular maintenance treatment, in addition to using it as needed.
Same inhaler, different frequency of use.
Got it.
Exactly.
So what if that's still not enough to keep your asthma in check?
That's when we'd consider stepping up to step 4.
Okay.
Here, we increase the dose of ICS formoterol,
Okay.
either by taking more puffs per dose or using it more times per day.
Right.
The goal is to find that optimal dose that keeps symptoms under control and minimizes risk.
Makes sense. And what about step 5, the final frontier for the toughest cases?
At step 5, we continue with the high-dose ICS formoterol.
Okay.
But additional medications might be necessary.
Okay.
These could include a long-acting muscarinic antagonist, or LAMA, which is another type of bronchodilator.
Or even those biologics we mentioned earlier.
Right.
And at this point, it's crucial to remember that severe asthma is complex.
Okay.
And GINA strongly recommends referral to a specialist.
All right, so that's track 1.
Okay.
What about track 2?
Right.
What does that path look like?
The key difference with track 2 lies in the reliever medication.
Okay.
Here, you'd use either a SABA,
Yeah.
like the familiar albuterol,
Right.
or a combination ICS-SABA inhaler for quick relief.
Got it.
And the maintenance treatments vary depending on the step.
Okay.
For example, at step 1, you might not need any daily medication,
Right.
while at step 3, you could be using a low-dose ICS or an LTRA,
Okay.
which is a leukotriene receptor antagonist.
So there's more flexibility in track 2.
There is.
But it also sounds a bit more complicated
Yeah.
with all those different reliever and controller options to juggle.
You've hit the nail on the head. It
Yeah.
can be more intricate,
Okay.
which is why track 1,
Mhm.
with its streamlined approach and proven effectiveness, is generally the preferred first-line choice.
Makes sense.
But there are definitely scenarios where track 2 might be the better fit.
Okay.
Maybe someone has concerns about ICS formoterol,
Mm-hmm.
or maybe they have difficulty accessing it.
Right.
It really comes back to that shared decision-making we talked about.
Individualized care.
Yeah,
Always.
always.
Now, you mentioned LTRAs as a potential maintenance option in track 2.
Yes.
I know there's been some controversy surrounding those,
Right.
especially Montelukast. Can you shed some light on that for our listeners?
Yes, there have been concerns about potential neuropsychiatric side effects with Montelukast.
Sure.
GIA acknowledges this
Yeah.
and recommends careful consideration of the risks and benefits before prescribing it,
Okay.
especially for children.
Right.
In simpler terms, for parents listening,
Yeah.
this means some children taking this medication have experienced mood swings,
Okay.
behavioral changes, or trouble sleeping.
Right.
So it's not a first-choice medication.
All right.
And it's essential to be aware of these potential issues.
Good to know.
Good to know.
And speaking of adjustments, we talked about stepping UP treatment when needed.
Yeah.
But what about stepping down?
Okay.
How do we know when it's safe to ease up on the medications?
Yeah.
Isn't that a bit risky?
Stepping down is an essential part of good asthma management.
Okay.
And the guidelines offer helpful guidance on how to do it safely and effectively.
Right.
It's not about stopping treatment altogether,
Right.
but about finding that lowest possible dose that keeps symptoms under control without exposing the patient to unnecessary medication.
So how do we make that call?
Yeah.
What factors do we consider?
We look at the patient's current symptom control,
Uh-huh.
their risk factors,
Okay.
their past experiences with stepping down,
Yeah.
their lung function, and of course their preferences.
Of course.
We also consider the timing.
Okay.
We wouldn't want to step down during allergy season, for example.
Right.
Or when someone's battling a cold. It's like a delicate dance.
It is.
Finding that perfect balance,
Yeah.
but having those guidelines and a collaborative approach makes it much less daunting.
Absolutely. It's all about working together,
Yeah,
patient and doctor,
right.
to find that sweet spot.
Now, I know we've been throwing around a lot of technical terms and acronyms,
We have.
but for our listeners who are parents, don't feel overwhelmed.
Yeah.
The most important takeaway here is this.
Okay.
Asthma management is becoming more personalized and proactive than ever before.
It is.
It's about working with your child's doctor to assess their individual needs, develop a tailored treatment plan,
Right.
and adjust that plan as needed to keep their asthma in check.
Exactly.
These guidelines are a roadmap,
They are.
but it's a roadmap with many potential routes.
Yes.
The key is to choose the route that works best for each individual child.
Absolutely.
So we've covered a lot of ground today. We've unpacked those two treatment tracks.
explored the ins and outs of stepping up and stepping down treatment.
Yeah.
And addressed those burning questions about LTRAs. But there's still one crucial piece of the puzzle missing. Those little ones under 6.
Right. Managing asthma in this age group comes with its own unique set of challenges.
It does.
And the GINA guidelines offer some invaluable insights for parents and clinicians alike.
Excellent, because I know our listener is eager to hear about that.
I'm sure they are.
So stay tuned, folks.
Okay.
In part 3 of our deep dive, we'll tackle the world of preschool asthma, exploring everything from diagnosis and treatment to the crucial role of education and empowerment.
Looking forward to it.
We'll be right back. Welcome back to the deep dive.
We're in the final stretch of our exploration of the 2024 GINA guidelines.
And this time, we're putting on our parent hats.
Yeah.
And tackling a question that's probably on the mind of every parent listening.
Okay. Oh.
What do these new recommendations mean for my little one? You know, those adorable but sometimes baffling kids under 6.
It's a tough group.
As we mentioned earlier, diagnosing and managing asthma in this age group can be tricky.
It can. Those tiny humans aren't exactly known for giving detailed symptom reports.
No, not at all.
But we've got to start somewhere.
You do.
So, as a parent, what are the warning signs that should make you think, could this be asthma?
Okay, so first and foremost,
Yeah.
you're looking for those classic symptoms we've talked about.
Right.
Wheezing, coughing, shortness of breath, and difficulty breathing.
Yeah, and pay close attention to when these symptoms occur.
Okay.
Are they worse at night? Do they happen after running around or laughing?
Okay.
These clues can help distinguish asthma from other conditions that might cause similar symptoms.
So we're playing detective a bit,
We are.
looking for patterns.
Yes,
And I imagine family history plays a role too, right?
it does.
If asthma or allergies run in the family,
Right.
that's a red flag.
If you or your partner have asthma or allergies, or if your child has eczema or food allergies, the chances of their wheezing being due to asthma are higher.
Okay.
It's all about putting the pieces of the puzzle together.
And speaking of those pieces,
Yes.
you mentioned earlier that lung function tests like spirometry,
Right.
aren't reliable in this age group.
Yeah, they're really not.
So how do we know for sure what's going on in those tiny lungs?
Unfortunately, there's no perfect test for asthma in young children.
Okay.
They just can't follow the instructions for spirometry reliably enough to get accurate results.
So we're back to relying on good old-fashioned observation.
We are.
What should parents be looking for?
Pay close attention to their breathing patterns.
Okay.
Are they using extra muscles to breathe, like those in their neck or chest?
Huh?
Is their breathing labored, rapid, or noisy?
Got it.
Listen for wheezing, of course.
Right.
But also for other sounds like crackles, which could indicate a different problem altogether.
It sounds like a multisensory assessment.
Is.
Using our eyes and ears to gather information.
Absolutely.
And what about treatment?
Okay.
We talked about those two-track approaches, but how does that apply to these little ones?
The fundamental principles are the same,
Okay.
but the specifics are tailored to their needs.
Okay.
The goals are to control symptoms, minimize future risks,
Right.
and choose medications that have the fewest side effects.
Yeah.
We want those little lungs breathing easily, those little bodies sleeping soundly,
Of course.
and those little personalities free to play and explore without limitations.
Right. Those are the outcomes that matter.
They are.
And I'm guessing the first-line treatment is still inhaled corticosteroids.
Yes.
Those ICS we talked about earlier.
You got it. Inhaled corticosteroids remain the cornerstone of asthma treatment for all ages.
Okay.
They're like tiny firefighters, tackling that airway inflammation and preventing those pesky symptoms and exacerbations.
Okay, but how do we get those medications into the lungs of a toddler who's more interested in throwing their inhaler across the room than using it?
That's where those PMDIs with valve spacers and masks come in handy.
Right.
Remember those 2-in-1 shampoo and conditioner analogies?
I do.
This is the delivery system that helps get that shampoo where it needs to go.
Makes sense.
Makes sense.
The spacer helps slow down the medication so little lungs can inhale it more easily.
Yes.
And the mask ensures it's delivered directly to the airways, even if they're not coordinating their breathing perfectly.
Exactly. It takes the pressure off parents.
Yeah.
And makes the whole process much easier.
Speaking of pressure.
Yes.
I know firsthand that getting a toddler to wear a mask can feel like wrestling an alligator.
Oh, for sure.
Any tips for parents who are battling the mask monster?
Patience, my friend, patience. It might take some time for your child to get used to the mask.
Yeah.
Try to make it fun. Let them decorate the spacer with stickers. Or turn it into a spaceship.
Yeah.
Distraction is your best friend. Sing songs.
Yeah.
Tell stories. Anything to keep them engaged while they're inhaling.
And remember, a calm and confident parent makes a world of difference.
It does.
Kids pick up on our anxiety.
Yeah.
So take a deep breath.
Right.
Channel your inner Zen master.
I like it.
And approach the whole thing with a positive attitude.
Couldn't have said it better myself.
Now, beyond medication, there are also some non-drug strategies that can help prevent asthma in the first place.
Yes.
Or at least reduce the risk.
Right.
Remember how we talked about breastfeeding being protective?
Yeah.
That's a big one.
It is.
Especially in those early months.
Absolutely. Mother Nature knows best.
What about introducing potential food allergens early on?
Okay.
That seems counterintuitive.
It does.
But I know the guidelines have changed on that.
They have. The research now supports introducing potential food allergens like peanuts early in life. This helps build tolerance and reduce the risk of developing food allergies, which can be a trigger for asthma symptoms.
It's amazing how much we're learning about asthma and how to prevent it.
It is.
But even with the best prevention strategies, some kids will still develop asthma.
Right.
And that's where education comes in.
Couldn't agree more. Parents are the front line in managing asthma in young children.
Right.
They're the ones giving the medications.
Yeah.
Recognizing early warning signs. And deciding when to call the doctor.
Yeah.
They need to feel empowered and informed.
So what can doctors do to make sure parents have the knowledge and support they need to be those asthma superheroes?
It starts with communication.
Okay.
Doctors need to explain asthma clearly, answer all those questions patiently, and address any concerns.
Right.
They should demonstrate how to use the inhaler correctly and provide a written asthma action plan that outlines what to do if symptoms worsen.
That written action plan is a game changer. It takes the guesswork out of those scary moments when your child is struggling to breathe.
Exactly. It empowers parents to take action quickly and confidently.
Right.
potentially preventing a minor episode from becoming a major emergency.
And I'm guessing these action plans are individualized.
Absolutely.
Just like everything else we've talked about today.
We consider the child's age, their triggers, their medications, and the severity of their asthma.
Okay.
And we use clear language and simple instructions so it's easy for parents to understand and follow.
It's all about meeting parents where they are.
It is.
And giving them the tools they need to be effective asthma managers for their kids.
Well said. We've covered a lot of ground in this deep dive into the 2024 GINA guidelines.
We have.
We explored the shift from severity to symptom control and risk assessment. Those two innovative treatment tracks.
Yeah.
The unique challenges of managing asthma in young children.
Right.
And the importance of education and shared decision-making.
It's been quite a journey.
It has. And as always, the most important takeaway is to stay curious.
Yeah.
Keep learning. And advocate for the best possible care for yourself, your patients, and your children.
I couldn't agree more.
Thanks for joining us on this deep dive into the fascinating world of asthma.
Until next time, remember, knowledge is power.
It is.
Especially when it comes to breathing easy.